Every year, more Indians die of heart attack than any other country in the world. Not the US, not an aging European nation, but India, one of the youngest countries in the world. And I spent 20 years asking why. Because the patient I see, they are not very unhealthy people. They exercise, many eat home food, some even get their annual health checks. Their reports come back not very bad. And then one morning, they don't wake up. I want to show you what that annual health check is missing. And by the end of this video, I will give you the exact list of tests you need to ask your doctor for. Tests that can predict heart attack 5 to 10 years before it happens. I am Dr. Harsha, stroke, lifestyle and prevention medicine specialist based in Bangalore, and what I am about to tell you, most people only find out after their first cardiac event. Here is the most uncomfortable truth about heart diseases in India. Indians get heart attacks nearly a decade earlier than people in the West. The average age of a first heart attack in India is 53, whereas in the US it is around 65, nearly 12 years earlier. And in my clinic, I am seeing this shift further. Software engineers in their late 30s, people who run half marathons, people who would look perfectly healthy to you on the street. Why? Because the standard health checks, the one most Indian doctors run every year, was designed for a Western population. It was not designed for our biology, our stress levels, or our diet patterns. It checks the wrong things and it misses the markers that actually predict a heart attack in Indians. Today I want to change that. Stay with me. The last point I cover is one that surprises people the most. The first hidden killer is inflammation. Most people think heart attack is only about cholesterol. Cholesterol is part of the story, yes, but it is not the full story. You can have perfectly normal cholesterol and still have a heart attack. I have seen this more times than I can even count. Here is what the research now makes very clear. Inflammation in your arteries is what turns cholesterol deposits into dangerous plaques. Without inflammation, cholesterol does not stick to the arteries. Without inflammation, plaques do not rupture. There is a landmark study, the CANTOS trial, where the researchers took 10,000 patients with heart disease, already on cholesterol medication. Their LDL was controlled, but their inflammation was still elevated. When they lowered only the inflammation without touching cholesterol at all, major cardiac events dropped by 15%. And in the patients who got their hs-CRP all the way down below 2, the benefit was even greater, a 31% reduction in heart attack related deaths. The test you need is called high sensitivity CRP. It is a simple blood test. It measures inflammation in your body. Most annual health checks in India do not include it. You have to ask for it. I had a patient, 44-year-old IT professional in Koramangala, ran every morning. His cholesterol was perfect, but his hs-CRP was elevated and no one had ever checked it. We found the problem before his arteries did. Now, inflammation is dangerous, but what I am going to show you is what makes Indians specifically more vulnerable than anyone else. This is the part most cardiologists do not talk about in a 10 minutes consultation. The second problem is that we are measuring cholesterol the wrong way. Your standard lipid panel checks LDL, what most people call bad cholesterol. But LDL is not the only particle that causes damage. There are other particles, VLDL, IDL, that also build plaques in your arteries. And your LDL number does not count them. There is a better test. It is called Lipoprotein B. Every single particle that can cause damage has one ApoB molecule. So when you measure ApoB, you are not just counting LDL, you are counting every dangerous particle in your blood, not just LDL. This matters especially for Indians because we have a higher rate of insulin resistance. Prediabetes, fatty liver, PCOS and insulin resistance is exactly when LDL and ApoB stop moving together. Your LDL looks normal, but your ApoB is elevated and your arteries are silently getting damaged. I target ApoB below 60 mg per deciliter in my patients. Most guidelines say 100 is fine. But plaque starts forming well before. We are not here to be an average. We are here not to have a heart attack. Now here is the one that surprises most people. There is a genetic marker that 1 in 5 people carry and it can double or triple your heart attack risk. It does not show up in any standard panel. You cannot change it with diet or exercise. Most people have no idea they have it until something serious happens. It is called Lipoprotein A, LPA. And elevated lipoprotein A is one of the most common reasons I see fit healthy Indians in their 40s having strokes, heart attacks with absolutely no warning. Lipoprotein A is almost entirely genetic. It stays elevated for life. The American Heart Association now recommends every adult get it checked once, just once, because the number does not change throughout your life. If yours is elevated, we cannot lower it with current medication, but we can lower everything else around it ApoB, blood pressure, inflammation aggressively to reduce your overall risk. One of my patient, a 38-year-old, no family history, he knew of cholesterol normal, came in after his brother had a heart attack, and we ran a lipoprotein. It was severely elevated. We caught it. We changed his trajectory before he became a statistic. The fourth hidden factor ties everything together, and it is probably the most common root cause I see in Indians. Insulin resistance, and this is where Indian biology becomes a real problem. Indians develop insulin resistance at a lower body weight and younger ages than any other population. You don't need to be overweight. You don't need a family history of diabetes. You can look slim and still have a significant insulin resistance. Why does this matter for your heart? Insulin resistance drives inflammation. It elevates ApoB, it raises triglycerides, it increases blood pressure. Fixed insulin resistance and almost every cardiovascular risk marker improves at the same time. But here is the problem. The standard tests, fasting sugar and HbA1c, they look normal even when insulin resistance is already advanced. Because your pancreas is overworking 3 times as hard as to keep these numbers in range. The sugar looks fine, but your body is already under enormous stress. The test to ask for is fasting insulin level. Run it alongside your fasting glucose. If your insulin is high while your glucose looks normal, your pancreas is already in overdrive mode. And we need to fix that now before it becomes type 2 diabetes, before it damages your arteries. So here is exactly what I want you to do this week. Call your doctor and ask for these 4 tests. Write them down. Number 1, high sensitivity CRP. This is your inflammatory marker. Target below 1. Number 2, ApoB. This counts every dangerous cholesterol particle. Target below 60 to 70. Number 3, Lipoprotein. Check it once in your lifetime. Know your genetic risk. Number 4, fasting insulin alongside your fasting glucose and HbA1c. Catch the insulin resistance before it catches you. These 4 tests cost very little. They are available in any diagnostic center in India, and they can tell you thing about your heart that no standard checkup will show. Indians are not dying of heart attack because we are unlucky. We are dying because we are being checked with the wrong tools. Remember, Indians are not dying of heart attacks because we are unlucky. We are dying because we are being checked with the wrong tests. Know your numbers, right numbers. Share this video with one person you love who is over 35 years. One conversation could change everything. And if you want to know the one imaging test that can show you whether plaque has already started building in your arteries, silently years before a heart attack, I am covering that in the next video. Subscribe so you don't miss it.